Union leaders say the Quebec government doesn't seem to be in a rush to resolve issues that put public workers on strike. 420,000 are out, including teachers and social service workers. And on Monday, tens of thousands of nurses and other healthcare workers will join them. Unions are pushing for higher wages and better working conditions. They're calling on the government to hammer out a deal by December 19th.
It's pretty late in the negotiations. We need to start talking about the big issues at the table.
Union leaders say they may resort to a general unlimited strike, which would keep workers off the job indefinitely. But the province appears ready to wait it out. But waiting it out is something some patients just don't have the luxury of doing. A Vancouver Island woman is blaming Canada's long wait times for the spread of her cancer.
Is that this can't be, like this is a nightmare that I'm just not waking up from.
Lonnie Atwood underwent surgery for a rare and aggressive cancer, but had to wait 10 months to see an oncologist for chemotherapy. She says in that time her cancer progressed to stage 4. And Lonnie's not alone. The Fraser Institute found that surgical wait times in Canada have hit an all-time high, and they're the worst in the Atlantic provinces. CTV's bureau chief, Creeson Agecoutay, has more.
People living in the Maritimes are facing the longest wait times in the country for specialized medical care. According to the Fraser Institute, the wait time in Nova Scotia is more than 56 weeks, nearly double the national average. PEI comes in at second at 55.2 weeks, and New Brunswick at third at 52.6 weeks. Meanwhile, Ontario has the shortest wait time.
It's unacceptable. What they're going to do about it, I don't know. You know, it hasn't changed.
58-year-old Leslie Tilley suffers with severe scoliosis and was undiagnosed with COPD for 7 years before finally finding a doctor a month ago who discovered she has stage 4 COPD. She says she is in extreme pain every day, and it will be years before she can be admitted into a pain clinic.
If I make a dinner, I end up having to sit down for the rest of the evening. I have to have a nap in the afternoon. And the reason I'm napping is because of pain. The pain sucks the life out of you.
Nova Scotia's wait time is a small improvement from last year's 58.2 weeks. Health officials say they're trying to catch up in a post-COVID pandemic environment.
We fell behind because we had to close down elective cases for quite some time.
This week, Nova Scotia's health minister says they are making improvements to healthcare and tackling the surgical backlog.
We've done an additional 1,000 surgeries this year over our baseline year in 2019.
But doctors of Nova Scotia says more healthcare workers and more hospital beds are needed.
It takes time to attract people, it takes time to train people.
Nova Scotia's premier has also promised to extend operating room hours, with physicians receiving a premium for after-hours surgical work. But even that is a balancing act for healthcare officials. Creeson Agecoutay, CTV News, Halifax.